Welcome back to Wave Listens Live. Joining me now is Dr. Regan Ackerman of Freedom Mini Dental Implants. As always, she's here to talk about her small diameter, less invasive implants that really are just easier from the start all the way to the finish. Welcome back to Listens Live.
Thank you.
You always bring show and tell. You know I like that, and I'm going to tell you that every time that you come here because I do really appreciate that. For those who are unfamiliar with your implants, remind everybody what you do and how you help somebody make their smile better every day.
Yeah, certainly. So the mini implant, like you said, just a smaller diameter implant, so it's a lot less invasive, a lot less healing time. When I place my implants, first of all, I don't have to have a ton of bone. So a lot of people that were told they weren't candidates for implants, a lot of times I'm able to help them out. So, but I just do local anesthetic. I don't have to put people to sleep, no incisions, no stitches, and I use them in many different ways, which I know we'll highlight today. Floppy dentures, people struggling with dentures, if you want to get rid of the denture glue, we can use them to snap your denture on. I can use the mini implants to get rid of your denture completely, have permanent teeth that you don't have to take in and out. If you're just missing a single tooth or maybe a couple molars in the back and you want more to chew with, I can help out with that too.
You mentioned the floppy dentures, and that's something that could be easier because maybe you've already got the dentures, you like what they look like, but you hate what they feel like, and you just don't like taking care of them quite like that. You can take somebody's dentures, turn them into something that fits in their mouth where they're comfortable, and it doesn't really feel like you've got dentures in it at all.
Yes, so I do it all the time. This is kind of the model of the snap-in denture. Like you said, if they have a denture and the bite's good, they like the aesthetics, a lot of times I can save them money and use that same denture. But I will add the mini implants, so no incisions, no stitches, just numbing up with a little local anesthetic. A lot of people like to say Novocaine. The day I place these implants, I will put these attachments inside their denture, and they will leave that same day with the denture now snapped on to the implants. So no more floppy denture, no more worrying if it's going to fall out when you sneeze or when you eat, no more having to put gobs of denture glue in there to keep it in. So the denture will snap in, you'll take it out once a day, rinse and clean everything, and snap it right back in. And this is definitely a very, affordable option, especially for people that have been other places and gotten quotes for, like an all-on X type of thing.
And I assume you can also maybe shave it down a little bit to make it more comfortable, just something that fits in their mouths a way they're more comfortable with as well.
Yeah, sometimes a lot, like this was for an upper. If they have good enough bone, I can trim the roof of the mouth off and help with that gaggy feel and get some taste back, 100%.
And you see what that looks like at the end, but at the bone, it's interesting too, just the size difference from what some of the implants are that require essentially cutting into your gums.
So I can show you
That's
that
not what happens here.
Yeah, so big difference. I think this speaks volumes for the difference in implants. I'm not making this big hole right here, so I do not have to have a ton of bone. I don't have to make an incision. Like I said, I'm just going to numb up with this little local anesthetic and make this little pilot hole right here. And then my small diameter is a little titanium screw, that one piece that screws into the jawbone. And then, like I said, we'll use it for a snap-in denture or a roundhouse bridge or just a single tooth. But as you can see, a lot of people were told they weren't candidates for implants and they don't think they have another option. So please call the office. It's a free consultation. We'll take a 3D x-ray so I can confirm that you have enough bone for me to place that little pilot hole right there.
Yeah, and it's family when they walk through the door, because it is literally your family.
Yes.
When they walk through the door.
Yes. So we're a small office. My husband works with me. He's my assistant. He's the first person a lot of people meet. He'll take your x-ray. But yeah, we're a family-owned business. We have one other employee, so we're not, you're not going to get lost in the shuffle at our office. We really do get to know our patients. Like I said, most of our procedures, if you do a snap-in denture or the bridges, we're going to see you once a year anyway, and so we just get to know people.
Yeah, let's take a look at some of those people, some of the people who have come to you for help and that you've been able to give them the solution that they're looking for.
Yes, so this is Chris, and I love this before and after too, because he needed his upper teeth taken out, but I don't think we changed his smile drastically. I mean, obviously we improved them, but as far as when he smiles, it's not, so many people are worried, like, I don't want big horse teeth or denture, but we were able to do, he got the more permanent teeth, what we call the roundhouse bridge. So he comes back and sees me every 6 months, and I remove them. They're super easy to clean, and then we snap them back in. He has nothing on the roof of his mouth. He can taste all of his food. He brushes those just like regular teeth. But you can see, you know, his dentition was failing him on the upper, and he knew he needed his upper teeth taken out. So we were able to restore that and give him an option that he could afford, and that's not a denture.
And I think he's a good example too of, you're not going to push someone to get more than what they need. You want something that's going to work for them specifically in their situation. The top was where the priority was.
Correct.
And you were able to help him with that to a point to where it looks good, and you're not even going to notice maybe some of the problems that he was worried about before, at least visually speaking, on the bottom.
We're not a cookie cutter, like it's one treatment plan and one cost, and that's it. You know, we have a lot of different ways I can do things, and I try to work with you. And if, you know, that for him the upper was the priority, so that's what we focused on, and that's what we got done. And a lot of times we'll do different procedures on one art, you know, something different on the top versus the bottom to get them in a budget that they're comfortable with. So yeah, like I said, we're small office, not corporate. We're not going to push you, you know, to sign on the dotted line when you come in. It's a free consultation. So if you're struggling or know a loved one struggling with dentures, maybe they're not going out to eat anymore, they're not going to social functions because they're struggling with their dentures or their smile, please call the office. It's 937-4930. You can check out our website with more information at freedomimplants.com.
freedomimplants.com. Call that number on the screen, 502-937-4930. It's really that easy. Get on track to bring your smile back. Dr. Ackerman, thank you.